Hello, everybody. I will start on Bulgarian because we are in Bulgaria. Уважаеми представители на академичното ръководство, уважаеми колеги и гости, за мен днес е радост да ви приветствам с добре дошли на поредната наша алумни среща. Този път с възпитаник на факултета по дентална медицина, който е англоговорящ. Аз съм доктор Елена Даскалова и съм председател на Алумни клуба на Медицинския университет Пловдив. И днес имам удоволствието да ви представя доктор Андрес Кортезис, който се дипломира в факултета по дентална медицина през 2019 година, след което в началото на своя професионален път работи на 3 различни места в дентални клиники, работи в 2 различни държави, говори 5 езика и останалото ще дам думата да разкаже той. Само искам да вметна, че накрая ще имаме раздел за въпроси и отговори. Гостите, които са онлайн, моля да пишат техните въпроси в чата. Давам думата на доктор Кортезис.
So, hello everyone. My name is Andreas. For those who didn't meet me before, I finished this university in 2019, okay? Basically, a lot of you would be thinking, why am I here? Who am I, right? A lot of UK students probably are wondering what to do, NHS, private, right? So the reason I'm here and doing this presentation is because I want to share with you my experience. I'm not here to say how successful I am, how of an amazing dentist I am, because I'm still a student just like you are. So I finished in 2019 and some things happened in my life and I didn't know what to do. And until after graduation, I didn't know what I was doing. My plan was always to go to England, but I didn't know how. I didn't want to work in the NHS. And so I went to Cyprus, right? That's why I want to tell you a few things. In Cyprus, I worked in 3 clinics, and you have to listen carefully because you'll understand why it was 3 clinics. Why am I not still working at 1 clinic, you know? So I went to this clinic, very high-end clinic, very CAD-CAM, CEREC, laser, everything, you know. And I was like, wow, this is amazing. You know, I'm really good. You know, I'm an amazing dentist. This guy took me from nowhere. Okay, cool. It was a chance that I actually grabbed because I went there. I said to him, you know, can I see how a CEREC works? I didn't come for a job. I didn't come for anything. You know, I just want 2 hours of your time. So he was like, you know what, actually, we're looking for a dentist. I was like, okay, great, you know. Like, it was literally 2 weeks after graduation. So this is my introduction. And then I realized a few things. I'm going to talk in more detail about all these clinics after, okay? So then I went to another clinic and then another. Then I thought, okay, England is good. England has opportunities. I'm going to go to England. Now I'm here. England has been pretty good, okay? This is a very short explanation of me. So I want to talk about who's here in 5th year, or is everyone 6th year? Everyone 6th year? 5th, okay. Okay, I have a lot to say. So talking to some people that are still here that I used to hang out a lot with, you know, Gleb actually never complained about this uni, I must say, but a lot of yeah, a lot of students here say, you know, not about this university, but complain this, complain that, whatever, you know, either about exams or this university is actually not as hard as you guys make it. 5th years, 4th years, 3rd years, you know, they give you a lot of information for you to use. I was stupid enough not to use this information. I was an okay student. I wasn't the best, but I didn't realize these things, and that's why I want to tell you. There's a lot of things to actually learn in this university. About exams, I hear this year I think it was quite hard for you guys. Exams, I don't know where your fourth year is easy, fifth year was quite hard, right? I'll tell you a little story about third year conservative exam. Third year conservative exam was on my birthday, right? 10 days studying every day. 14th of June, I had with Associate Professor Stefanova and Professor Manchorova. I was like, okay, I'm going to smash it. Like, I made a reservation, W Club, all my friends there, 40 people, I'm going to do the exam, and that's it. I'm going to go to the exam, I'm going to do it, and then I'm going to have an amazing time. So I woke up really cocky, right? But I knew I studied quite a lot. I went to the exam. I was waiting the last one. I put on my shirt, everything gelled up, everything. I was like, okay, this is the day, this is going to be amazing, right? And I go in the oral part, and I got lost. I got nervous. As nervous as I am now, actually. So I didn't know. I paused. I froze. Professor Manchora was pretty angry. And she was like, that's it, fail. And guess my face when I went to W Club that night. Was not happy. But I must say that I still want to say thank you to Professor Manchorova, to Associate Professor Stefanova for, it wasn't about whether I could do it or not. They taught me a lot. That time that I was a bit angry, that I was a bit whatever, mostly with myself, actually, not with them. It was my fault, because I didn't deserve to pass, so stop crying about exams, okay? Another thing that I've seen in uni while I was studying, right? A lot of hate, a lot of competition that's not healthy. Oh, you got 4, I got 5. Oh, she got 6. She didn't study, she got 6. Forget about it. It doesn't work like that. You don't prove anything to anyone but yourself. And you have to realize this, that it's not about who got what and how much you get now is what you do after university. And if there's anything you want to prove, is you have to prove to yourself. So whether you got a 4 or a 5 or a 6 or whatever, it doesn't matter. The only difference between you and the person sat next to you, you will see in the future, is how persistent and committed they are to learn and to actually be a dentist. Not about who got 5, who got 6, whatever. So it's all about consistency. It's all about knowing your stuff, being bold. So yeah, what I want to say is that there is good competition and there's bad competition, all right? Good competition is when you compete, but in a way that you push each other. Because I had it with my friends. I had it until 1 year ago with a friend that I went to England with. Some of you know him, maybe Jacopo. He's becoming a very good dentist. His endos are much better than mine, I must admit. So what I want to say is that don't compete and have these negative thoughts and hate and whatever about 5, 6, whatever. It doesn't matter. Okay, you're here to learn. You're here to push each other to be better. There's, what's the population of the world? I don't know, 7 billion? 7 billion patients in the world. You're all going to get a cut, like, don't worry. But yeah, so these are the things I want to talk about university. Like another thing, for example, we have Dr. Zlativ, right? Dr. Zlativ, associate. I apologize. Associate Professor Zlativ, right? I see people are scared of him, yeah? I was as well. Dental materials, oh my God, why do we need to know that? Whatever, Only now, this year, I realized how stupid I was that I actually wasn't studying dental materials, that I wasn't, second year prosthetics. Oh, why do we need to do these wax ups? Why do we need to do the dentures? Like, the technicians do it, whatever. It's not like that. I changed 3 labs this year because the technicians were a bit too cocky with me, and they thought that I don't know. So if you don't know these things, they will use you and abuse you, the technicians, because it's business world. It's not only about, so it's good to know your stuff. It's good to know how Professor Vlachova is very strict is good, because she wants you to learn and to know the stuff. So these are things that I wanted to talk about before graduation. Okay, so now some steps after graduation. So for those of you who missed out, my name's Andres. Hello. So when I graduated, I went to Cyprus. I found this job very fast. I jumped on it straight away. It's the most expensive clinic in Cyprus. I have proof here. And, high technology, fillings with lasers, and I was like, you know what, I'm going to learn from this place. And back then I was green. I didn't know how other dentists could use me, not use me. You're there, you're like an apprentice, so you just go with the flow. And it was hard because first 2-3 months, what you do, you just watch, you clean, you basically just say, okay, I will do it. Okay, I will do it. So that's another thing. Whoever is very confident now and thinks that they're an amazing dentist, snap out of it. Like, you're not. You have to learn. You have to practice. You have to continue educating yourself and practicing. Anyway, so after 6 months working, actually, I'll tell you something else. 4 months after working, COVID hits. I was sick of working at that clinic. The way that everyone else was treated wasn't the best in the clinic, because it was like a 1-star kind of clinic. I'm the dentist. I must say it wasn't bad, but it wasn't for me. I was taking too much for myself. So I was actually thinking of quitting dentistry. I was like, I don't know if I want to do this in Cyprus. Cyprus is amazing, but it's really small. Right. So COVID hit. Me and my friend opened a grocery delivery company. I was making 4 times my salary as a dentist having that company. That was for 4 months. We actually called it Corona Busters. But it was good. It was good. But then, I realized, what? I'm a dentist. I didn't study, 6 years for nothing. I didn't, I had to move. So when the 6 months of the first clinic was over, I went, it was like a trial period, and then you get a proper contract. So the guy said to me, here's your new contract if you want to sign it. And guess what the contract was? 3 years. And if I leave before those 3 years, I have to pay a fine of 25,000 euros. I was like, damn, I might be stupid, but I'm not that stupid, So I said, no, that's all, Then I went to another clinic. It was an old school clinic, but I could work. There's a woman, she let me work. It was good, but it was old school dentistry. I mean, like proper, like rubber dam, like didn't exist in her head, So that was about 4 or 5 months. And then I actually got a very good chance that Rebecca here is going to that clinic for some practice. Is a dentist. He is a prosthodontist. He finished in Ireland, if I'm not mistaken. And I purely went there just to learn. So it was a 80-kilometer drive, 80 kilometers there and 80 back, 3 times a week. And COVID, patients weren't coming at all. I was getting about 10, 20 euros a day. So my petrol, basically. Just eating at home, going there, back, learning, asking questions. He was strict, but it was good because I learned, Anyway, after that, I realized I need to spread my wings. And by spread my wings, I wanted to work independently. I wanted to take more risk. And my friend who was already in England said to me, one big point. I did not want to work for the NHS. Like, I do not want to do that. I'll explain why I didn't want to do it. I'm not saying it's bad, but I'll explain in a bit. So my friend was like, look, there's this job. One of the practices is a mixed practice, and we're trying to make some patients move from NHS to private. He's like, you're really good in talking. So do you want to come? I was like, what the hell? I thought I was a dentist. Suddenly, like, I have to sell stuff, So I was like, yeah, I don't care. I'll come, whatever. It was like during COVID, traveling was terrible, but I went. So yeah, I'm working there now. I started with something like 80% of the patients wanting NHS work, but with private prices. I don't know if you guys know how it works. It's called something like independent dentist. Now I'm something on 90% private, 10% those NHS wanting patients. And why? This is my second point, patient communication. On average, I see around 80 to 90 patients a week. I also work Saturdays, so I work 6 days. Yeah, I'm the maniac. But I work 6 days a week. I see 80, 90 patients a week. So imagine if you cannot talk to a person, you cannot explain things to a person, how bad your treatment, your outcomes, your patient expectations, which a lot of you will be dealing with, will be. Patients, look, dentistry now is quite competitive. It's not like back in the 70s where you're a dentist and you're automatically considered a professor. You don't walk around with a doctor sign, on your forehead. It's very competitive. It's not only about treatments, it's also about communicating. If you don't communicate with patients well, trust me, it's going to be hard. It's going to be hard for you. So you have to learn communication. That's why, yes, maybe it's hard to get Bulgarian patients, but what it does, it teaches you also a bit of communication. And Plomba Bispari is not the only 2 things you should know, if you know what I mean. But yeah, so you have to explain, you have to know what the patients want, you have to see what the patients are like, because trust me, I've been like very nice to patients and they turn out to be really bad. You have to analyze, you have to think, it's not only about treatments. So yeah, that's patient communication. Just keep that in mind. Just honestly, keep that in mind. Talk to patients, like, don't just, okay, you need one filling. I have all of my patients actually became private because of this, because I explain, I ask them, I remember the names, I remember the kids' names, I remember that they went on holiday 6 months ago. I asked them, and there, I had a patient 2 weeks ago. He's like, you know what, Andreas, you should become You should sell cars. Everyone likes you, you know, because I talk, and not everyone likes me, by the way. So, you know, you have to talk, you have to explain. Don't be just like, okay, I'm a dentist, and that's it. And you need this, you're going to do this. They need explanations. They need to know why they're spending that much money. Because I'm sure a lot of you thinking of dentistry are thinking of money too, right? So yeah, that's patient communication. So working for experience and gaining knowledge versus working for money. Okay. So I want you to be honest, all right? Who here is 60% more for the money? Like, raise your hands and be honest. Come on. No, no one? You're a bunch of liars. You're a bunch of liars. Well, anyway, so in the beginning, you do not think of money, because the more you think of money, the more messed up your treatments will be. Trust me, I've been there. When I went to work in England, I worked for a corporate company. Corporate company means only thinking about money. So they were like, yeah, do this, do that. We want, I don't know, thousands of pounds a day. So in a way, they make you want to sell treatments rather than provide. Because I refuse to say that I sell treatments. I provide treatments, because we work with health. Like, no matter the money, it's health. Yeah. So try to get this understanding that when you work in the beginning, don't think of money. I know it's not easy. I've been there. Like, as I said, I was working for 20 euros a day in the beginning in Cyprus. It's not easy, but step by step. You don't get paid today, you're going to get paid in 2 weeks, metaphorically. You know, step by step. Don't rush treatments as well. Don't like just think, okay, I need to learn how to work, and then I can think of money. And money will come. Anywhere I've been on courses, and I've been to quite a few now, and you know, everyone just say the same thing: money will come. So just try to learn, especially you guys now after COVID. I know you didn't have the chance as much. Well, me too, to be honest, because in Cyprus, I could have got way more patients if it wasn't for COVID. But, you know, it is what it is. So now we have to, let's say, work more and more to compensate also for that loss of time or whatever it was. And yeah, try to work for the knowledge, for the experience, especially the first 2 years, and then money will come. The more ethical you are, there's many aspects of ethical. There's ethical of, I'm not going to trim it. I'm never going to make a crown. Like I know dentists that refuse to do any prosthetic work. They just work with composite. That's a different kind of ethical. You know, it's their choice, whatever. So one main thing, if you can do it, search for a mentor. If you can find a mentor that will tell you, you know, for example, they give you a filling, you start doing a filling, they come check on you, that would be like amazing. And slowly, you will build everything to be better and better and better. Because I was also, you know, when I left uni in the beginning, I was like, what, crown prep? 2-minute job, like no problem. My first crown prep, it was like this. Like, I swear to God, it was terrible. My first root canal after uni was terrible, you know, because I was overconfident. And I know a lot of you maybe feel that way. You shouldn't. You should take step by step to actually make things happen better and easier for you. So in the first clinic I worked, right, which was high end, I learned this patient communication. The guy was amazing. That's how I'm going to break up my mentor. My mentor wasn't one dentist. It was like 6. First clinic I went to, this guy could sit next to a patient, and in about 4 minutes, they would sign a treatment plan of 20,000. And I was like, wait a minute, what's going on? But patient communication helped him, and that's how I learned it. I learned it from him. So that was one of my mentors. That's why I keep repeating patient communication. Second clinic I went to, this woman was old school. Like she was doing a root canal treatments with a pro taper, and she was filling them with like taper 2 GPs with perca, like proper old school. No rubber dam, nothing at all. If she did a filling, right, and the patient comes like in 2 weeks with a root canal treatment, well, pulpitis, she would blame the patient, and everything was the patient's fault. But she was old school, and she worked quite a lot. She had a lot of patients, but that's her way of working, and that's where I learned how not to work. That was my mentor in that sense. And the third one, who's a prosthodontist, he was old school prosthodontist, but he's really good. But he knew a lot of stuff. He knew about bioceramics. He knew about stuff that a normal prosthodontist wouldn't. So I was amazed. So in that way, he taught me some extra stuff that I forgot from uni. I didn't care about at uni, So I had those 3 different mentors, let's say. I went to England, and that was my 4th mentor. It was about for a week. I shadowed this guy, and he taught me how to sell treatments. And it was, it was like selling a car, and I didn't feel comfortable with it, because I realized that he's doing it all for money. And the treatment, so let's say you have, treatment plans can have 5 options. He would narrow them down to one option that he could do, and he would get the most money. Nothing with implants. He wouldn't never do implants. So like 12-unit bridges, whatever, something like that, which it was kind of unethical for me. So I was like, you know what? Okay, fair enough. He taught me, though, again, patient communication, to patient expectations, especially in England, of those you who will be working in England, is crazy. Like, good luck, guys. No joke. So he taught me all these things, and I was working, and I was making, like, God bless, good money, because I was selling. But 4 or 5 months into work, I was like, you know what am I doing? Like, I was progressing as a dentist in some ways, but I realized that my skills reached the limit. And I was like, okay, that's it. I can't do this. It's boring. I don't care about the money. Let's go on a course. I went to Scotland to a biomimetic course. Adam asked me a few questions, glad to. So it's something different. I'll speak briefly about it at the end. But when I went on that course, I've met many dentists. There was about 15 of us, and there was 2 dentists, the creators of biomimetics, came from America. And bear in mind, this course was in Scotland. I live in Southampton. That's like I had to take a plane. I didn't even understand Scottish. Like I was just shaking my head for the first day. I did not understand nothing. So I was like, anyway, I'm gonna go. I went, and when you I don't know, I don't idolize any famous people at all. I'm not that type of person. but I idolize dentists. Like, I don't know if you guys know Maxim Belograd, maybe Dr. Appa, Duval. Yeah, Dr. Duval. Yeah, they are good, you know. So I idolize them. The biomimetic guys as well, you know. So when I see them, you know, it's like, damn, am I like really here? You know, it's like, this is so good. They're going to teach me something, you know. So the course was amazing. And it wasn't only about what you learn at the course, it's also about the people you meet and the way they think. I've seen dentists that were sat next to me, 20-year experience, no confidence, zero. Why? Well, I don't want to be too bad, but they're working for the NHS for 20 years, doing the same thing for 20 years. So my head, like my brain started forming an opinion about how to progress in dentistry. So yeah, I went back to my practice, and I was like, okay, that's it. I'm a biomimetic dentist. I have no clue what I'm doing, but I'm going to do it. So that's where I started using the rubber dam. I know you guys didn't use it much, right? Like, trust me, it changes lives. Like rubber dam, I didn't use it much in conservative. I didn't care. Sorry. But once I started using it, it was like, you know, I started getting, because I never thought that I could use it. I was like, oh, this is just for dentists who want to become professors. No offense. You know, dentists who study too much. I don't even like studying that much, you know. So I was like, okay, I'm gonna try it. Once it doesn't work. Twice, it doesn't work. 3 times, boom. Okay, 1 tooth. Second, third, and slowly, by practice, you gain that skill. It's not about like, it's just believe in yourself more and try things. Don't be overconfident. Start putting implants, which I believe I heard a lot of graduates now want to go on implant courses straight away and do implants like now. I personally believe it's not a good idea. And I'll tell you why. Because a lot of you, right, would think, okay, implants, a lot of money, right? Yeah. So I'm going to do implants. I also thought a bit like that. But when I first had my first month in England, by the way, in England, you'll take out a lot of teeth, like a lot of teeth. I worked 19 months now in England. I looked at my chart the other day of how many extractions I did. I sent it to the girls here. I did 405 extractions in the past 19 months. Yeah. They don't like saving teeth. They do not like saving teeth. So the first month I worked in England, I broke 8 teeth. And I extracted I had 20 extractions because I didn't want to be too confident, but I broke the first 8 teeth. I was, you know, because imagine if I started doing implants, but I don't know how to take a tooth out properly, you know, and I was like, I was shaking. I was like, okay, any extraction I have, I'm just going to refer. I'm going to pay. I don't care, whatever. But it doesn't work like that. It's, you know, you will start gaining confidence once you get one case, then another, then another. I was quite a nervous dentist in the beginning. So I was pretty bad. Like I was shaking whenever I had an extraction after those 8 extractions that I broke. Like first upper molar broke, like only the roots left. And the guy is in pain and I have no idea what to do. I was like, oh my God, I'm going to jail, knowing the complaint system in England, you know. So Anyway, I managed. Now with experience, with confidence, with taking out harder cases, I take out anything that's not impacted. And I promise you that I can show you a big portfolio of my extractions, because why? I tried. Don't give up. If you mess up, don't panic. Don't panic. Build that confidence. It's like, you ride a bike. You fall once, you fall twice. Third time, maybe you fall after 20 seconds. And gradually you're going to get better. You're going to start doing wheelies and whatever. So just with any treatment, try to build. Now, for example, the past 6 months, I started biomimetics. Biomimetics is basically trying to save the tooth as much as possible. I reduced my root canal treatments like by 80% because I don't kill teeth. I try not to anyway. So I didn't do, maybe the past 8 months, I did maybe 4 root canal treatments, but I realized, wait a minute, I'm getting bad at this, and because you need to practice. And now I started paying more attention. I started doing root canal treatments. Please always use rubber dam, especially guys that are going to England, whether NHS or no NHS. Please use rubber dam, because if you don't, that whatever you say doesn't matter. If you don't use rubber dam, they'll just say whatever. They can basically make a claim because of that. So yeah, I mean, everything needs patience, needs time. Believe in yourself more than you think you can, because it depends on your goals, right? My goal, I cannot be static. I cannot do, that is one of the reasons I can't do NHS. So for those of you who don't know, probably not many, NHS is a system in England. It's a government system, and they have 5-6 treatments, and it's like a cycle. It just goes and goes on and on and on and on. And I've sat next to dentists who worked 20 years, and they have no clue. And trust me, I wish them all the best. I'm not talking bad about them. I don't like talking bad about any dentists in that way. I can only judge their treatment slightly, but they don't know. They know stuff that, were like 18th century stuff, and they don't want to progress. Okay, it's their choice. They want family life, whatever. But it depends, again, what kind of dentist you want to become. I personally don't want to be static. I move on all the time. I try to become better and better and better. I follow what I believe in. So I don't like ortho that much. I don't know about you guys, but I don't like, so I'm not going to follow it. It's not my thing. That's all right. It's okay. But yeah, so that is the point of how to build confidence as a newly graduate. Don't rush into things. Anyway, I'm not going to mention names. Someone asked me about, where do I go for an implant course, 10 days? I told them you can go, but if you don't know how to take out a tooth first properly, don't touch your implants. If you want to do, I don't know, onlays, let's say, onlays, overlays, whatever, but you don't know how to properly clean decay, because I'm pretty sure, because that was my fault as well. When I left from here, I was confident, but not confident. I left a lot of decay behind. Don't get me wrong. Trust me, a lot. So again, that's experience, but go step by step. Don't rush. Don't rush. Confidence will come. Money will come, and experience, So the other thing is experience. Everyone's like about experience. I have to get experience. I have to get experience. Experience is good if you're guided in a way. So you can have experience by just taking out teeth all the time. Okay, you got experience. But if you want to move in a certain way, There are new developments in dentistry, such as biomimetics, such as guided implants, bioceramics. Associate Professor Stefano did a course the other week, right? Photography, which is very important, trust me, even though it's nothing to do with teeth. Photography, I'll talk about it in 2 minutes, just, yeah. There's a lot of aspects. So if you just move only one way and you only do that way, yes, you will get, let's say, in one direction. But why do you need courses? You know, why do you need courses? Courses give you, that's this slide. So courses, what it does, it gives you guidance. It gives you guidance. You meet amazing people. You meet dentists who made it, who are consistent. You know, like, for example, why do you think Dr. Appa or Dr. Duval or Maxime, who I went to, when was it, in August, have like 400,000 or 500,000 followers on Instagram, have like, I don't know, probably a million pounds turnover, actually profit a year? Why do you think? Do you think they just, you know, oh, they're lucky or something? It's not about luck at all. Like, if you look into Dr. Appa, he's been working for the past 14 years, like in 3 different countries, and he's working 2 Saturdays a month. And he's got a family, I don't know, he's 43, whatever. You think they're just lucky? They're not. They're consistent. That's what I mean. Whatever you want to do in life, you have to be consistent if you want to achieve something more than just, I don't know, general. Like, you know, our professors, why do you think that they study and research more and more and try to, you know, 1, to teach us, and 2, to give a new perspective to dentistry, to give like a new, you know, new ways of showing us, for them, I believe, to progress as professionals. Is that correct? So, you know, otherwise they just stay there. Okay, class 1 by black, class 2, you know, it's good to know the fundamentals, but it's all about progressing and actually moving forward. For me, at least. I don't know about you guys. So all these dentists who you guys know, I know, it's not that they made it because they are lucky or they're famous or we put likes, you know, it's because they've been on it for past 10, 15, 20 years. So if you come out of uni now and think that you're one of them, you're very mistaken. Like, you need 10 years of thinking, eating, dreaming about teeth to reach their level, which they reached in probably 20 years or so. But yeah, so about what courses to go to. What courses to go to depends on what you want to follow. Like, as I said, I don't want to do orthodontics. I'm not going to go to orthodontics course. No way. Like, it doesn't interest me at all. I can talk a bit about England courses, like in England. So in England, any dentist makes a course, you know. Yeah, it's true. It's true. Okay, you know, come on, guys. I'm a biomimetic dentist. I worked with biomimetics like 8 months. I don't think I'm bad, but I wouldn't do a course for you. You know, I get like English dentists message me on Instagram trying to suck up to me in a way. So I go on their course. It's like, come on, chill out. You know, I don't want to go. I don't want to go on your course. It's, you know, another thing in England, you'll find these companies that do like dentistry A to Z, like everything about dentistry, and they do it as in one company. And I don't know, let's say there's 3 guys and they talk about everything. That for me is not cool. It's, you know, I wouldn't do it, because you like do some research before you go on courses. Courses cost a lot, by the way. So on average, a course in England costs around £700 a day. So usually we get two, 3 day courses. You're looking around £2,000. Well, that's how much I paid. I paid £2,000 for biomimetics. Was worth it. But that's why I say do your research. Don't go on random courses that whatever, you know, whoever just posts there and says, yeah, you will increase the confidence and you like increase private potential. Stop. Like just stop. So yeah, research into courses. Don't jump and like you're going to see a lot of ads. The other day I saw they put in this group about courses in England, and I think there was over 1,000 dental courses. Like, and to be honest, I would go to maybe 6 of them. There are really good dentists in England. There are some really good dentists, but you have to find them. Like, for example, I'm going on a course next week to Athens. This guy, like, search him on Instagram. His name's Cabination with a C. This guy's fillings, like, amazing. You would not understand whether it's a filling or a tooth. And he doesn't do courses. I just messaged him on Instagram. I said, hey, listen, I love your fillings. Like, you know, I really want to learn. Can we arrange something? He's like, well, I don't really do courses. He's young. He's a cool guy. And he was like, yeah, let's do it. I was like, okay, cool. When? Just tell me and I'll book the tickets. I'll come. It's worth it, 100%. So I'm having a one-on-one course with a guy. And just because I asked, I had the confidence or whatever, you know, just to tell him, you know, I am new. I don't know. You know better. Teach me, please. That's, well, yeah, you're humble, but yeah, that's confidence to ask, if you know what I mean. And guess how much he quoted me, which was actually very surprising. 350 euros for a one-on-one course. You will not find any price like that. Why? Because I asked. Just ask. If you find someone you like, how they work, even if they don't, you know, even if they say no, just ask. Can you show me, please? Can you do it? You know, that's another thing with competition. Me and my friend were always so competitive with Jacobo. Yeah, we're so competitive in the beginning, like, oh, you know, I do this better, I do that. And then we realize like we're both idiots. You know, he does endos better than me. I do biomimetics better than him. I know how to put a rubber down better, you know, and we realized like, okay, like, let's just help each other, you know, and maybe we can actually be better and move together, you know. So that's what we're doing now, you know. Today he posted a story, his first biomimetic prep. Proud of him. Really proud of him. Yeah, he helps me a bit with endo here and there. But that's what I mean. If you have questions, don't be too like, oh, I'm so okay, I can't. No, who is this guy? Whatever. Like, ask. And again, I tell everyone all the time. I got many students messaging me actually, even the ones who graduated, asking me questions, whether it's photography, whether it's biomimetics, whether it's about courses. 95% of the time I always reply. So if you guys ever want to ask me something, then you can, like, no problem at all. My ego is not that big for me to keep secrets, dentistry, you know. But yeah, so here's a course that I did online because it was, does anyone know Maxime Belograd or no? Yeah? Okay. So this guy has amazing, he's like smile design, veneers. He does around, I don't know, maybe 15 courses a month. And I've been following him since I was, I think, 4th year or 5th year. I don't remember, but it was, I love this guy's work. Even though back when I was 4th, 5th year, I was thinking mostly about parties. But, you know, I loved his work. I loved his work. And I was about to go to his course. And COVID happened. I wasn't earning much as a dentist. I was sick and tired. Back when, you know, it was okay with the company, but I was like sick and tired of not actually knowing stuff about dentistry. So I couldn't even go on his course. So I said to him, look, I emailed him. I still have the email, I swear. I emailed him. I said, look, I'll come. I'll be your assistant for 3 months. I want to just look how you work. You know, I'll do it for free. Like I'll be your driver if I have to, you know, just to understand how this guy works, because he's making it in life as a dentist and I want to be there. So why not learn? You know, some people charge for that with courses, which is amazing. Don't get me wrong. They're not doing, you know, they're sharing information that took them 20 years to learn. So it, you know, just ask and you will get help. So this is the online course. That's when I went there in when was it? August with the veneer prep, smile design, veneer prep under a microscope. That changes like the way you think. When you see things under microscope, when you work, first of all, you say, sorry, I'm going to swear here. You say, I'm really shit, right? I'm really shit as a dentist, because you see your work. And second of all, you're amazed of how good things can be when you see things properly. So this is me and him. You know, the first time I saw him, when he came to pick us up from the hotel, I was buzzing. I was like, this guy is my idol. He's my star. You know, like I was this close to asking his autograph, but yeah. So this is the fundamentals of biomimetic dentistry, which I did in Scotland, in Glasgow, which were with these two guys. This is on the older guy is David Ailman, and that's Davey Ailman, which they're really cool dentists. One of them, the older guy, actually wanted to quit dentistry after 14 years of working, and then he understood biomimetic dentistry and he was like, you know what, I like this. So yeah, just before I get into biomimetics, anything you want to ask me, can I after? Okay. So biomimetic dentistry, I'll be very brief with this, okay? What is our role and goal as restorative dentists, right? What do we do? You know, we fix stuff, right? But we fix stuff so our role is to bring back whatever was lost, whether through decay, wear, you know, and we are trying to bring it back the closest to how it was, like by doing stuff, right? So human-made process using materials and techniques that imitate nature. So there's a 6 lessons approach. There's direct restoration, which are fillings, semi-direct restorations, indirect, semi-direct. Does anyone know what that is? Semi-direct is basically an onlay, but you do it on the patient's mouth, in the patient's mouth with composite. So you build it up yourself and then you cement it. They should know. They should know. Anyway, so these two things is an absolute must, okay? One thing I want to talk about, because this reminded me, okay? You guys are gonna graduate now, whatever, yeah, right? And when I graduated, I was terrified. I was like, I have no idea what I'm gonna do. Yes, I felt proud, but what am I gonna do now? I see a lot of you believe that because you are dentists that just graduated, you can, well, those of you who can afford, or no, actually, probably most of us, whatever, can afford, but those who believe they deserve to buy some kind of amazing 50K car just because they became dentists, like, you should think twice before doing that, because the reason why I say is you deserve a lot as people anyway. You went through 6 years of dentistry, but you can invest so much in yourself, and things that you will invest in yourself will actually give you more, and you can buy a better car in 5-6 years. So don't get too comfortable from the beginning, right? So an absolute must. This is like, you have to have it. Okay. You like, if you can get it now, like today, get it. Loops. Okay. I struggled a lot without loops. So not struggled, but my dentistry was, okay. You know, first I bought loops that were 2.8 magnification. I changed them. They're really good. I was, again, buzzing because of that. I changed them within a year. Now I'm on 5.2, and I had the 5.2 for about 4 months. And I want to get a microscope because it's different. You have to, when you see things under, I do extractions now of roots only with loops. You won't be able to see, you won't be able to do surgical extraction, I believe, without loops, magnification. You won't, you know, so even extractions, you will use it. And trust me, you will thank me when you remember this. Another thing is caries detector. Because a lot of people think that we know exactly where decay is and blah, blah, and we just whoop, and we're in the pulp. Boom, root canal treatment. I came here for a filling. Why are you killing my tooth? What's your answer? Like, think you have a patient, you're like, oh, we're going to do a filling. Yes, you get consent forms and blah, 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 blah. But, you know, you put the decay detector, it tells you exactly where the decay is. There's certain, so like pink is affected dentine. Red is infected dentine. You will follow. It's something about methods, but buy this, please. Caries detector, I think it costs around £50, 60 euros, whatever. I had mine. I think I bought it. I have mine for 9 months now, so it's pretty good investment. Okay, some case presentation. I'll show you some of my cases. So DME. What does DME mean? Deep marginal elevation. Like, if you see those two, this woman, 67-year-old woman, she came to me and she said, look, I've been to 2 dentists. They told me I need to take those 2 teeth out. I can't do it. I need to save some teeth. Trust me, between those 2 teeth there, you know, there's no way, no possible way you can put a matrix band. There's no way. Matrix band is too short. It's not going to stay. It's nearly on bone level. And there are certain ways you close it up. For example, on the wisdom tooth there, if you check on the screen, oh yeah. So on the wisdom tooth, you see that decay is really, really, really close. And I was actually overconfident, and I went into the pulp. I put some bonding agent. Well, I stopped it with anesthetic, put some bonding agent, and continued to do a filling slowly. It's been now 6 months. She has no symptoms. Like, you know, I went into the pulp, saw the blood, everything, no symptoms. So what does that tell you? That you don't need root canal treatment, because I'm not doing root canal treatment on wisdom tooth. No way. But yeah, the woman was really, really, really thankful. Like, I told her it's really hard. I sweated with this. Like, I sweated to do this, but she was really happy. Okay, so biomimetics. What do we have here? We have really big amalgam filling. With amalgam fillings, what happens? First of all, there's leakage. Second of all, if the cusps are smaller or thinner than they should be, and do you guys, you should know this, but do you know what the difference between functional and non-functional cusps? Yeah? Okay, that's really good. I didn't remember it for a long time after uni, but anyway. Yeah, I honestly didn't know it until like a year after university, whatever. But we see this. So what do we see? We see that the cusps here are like, first of all, there's one non-existent. This one, I don't remember when I measured it, but it wasn't the thickest. This one is gone. I'm like, you would already see decay here, for sure. Here, you know, there's not much tooth left. So what do? You remove the amalgam first. You remove the amalgam and you measure the cusps. So the functional cusps, which are the ones that are in occlusion, should be at least 3 millimeters. If they're less than 3 millimeters, take them out, remove them. The non-functional, you can give it 2 millimeters. If it's less, remove it. So cut it straight. Don't even think about it. So this is the next step. Boom, I don't have cusps. I'm thinking, okay, I don't have cusp now. Now I need to put the decay detector to see so I don't leave decay in order for it to like progress. And then we have root canal treatment. Then we have a patient saying, oh, you're a bad dentist. I came for a filling. Now I have constant pain. It's the worst when that happens, trust me. It happened to be multiple times, especially in the beginning when confidence is low, you know, you just do a filling. Like another thing is, I don't even use the slow handpiece. I only use now the fast one. And that helped a lot. But anyway, so you put the caries detector, you rinse it, you dry it, and I removed all the caries, and this is what we're left with. So we're left with not much. But you see, what do you do with this tooth? Like in your case, what would you do? Does anyone want to answer anything? Oh, Gleb, Adam, any? Yeah. Why not crown? You know the difference between biomimetics and old school? Well, okay, I don't thank God that Professor Vlach was not here. The difference between biomimetics and full retentive. So retentive crowns and adhesive crowns is something different. Retentive crowns, we need the mechanical, the tapered walls, blah, 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 but you over-reduce the sides and you also over-reduce the neck of the tooth. The neck of the tooth is the most fragile from the whole tooth. So when you start practicing in the future, what you will see is that sometimes you'll get patients that will come with a crown in the hand and it's like boom, cut from the neck. Because the neck was too weak, all the masticatory forces, boom, it broke. You know, since I did biomimetics, I started realizing it. And I was like, well, wait a minute. Yeah, that's actually true. But yeah, so what happens is I remove everything and I put, first of all, I put a bonding agent, and then I put a flowable or resin coating. You see, I mean, my rubber dam skills are not bad there, I think. Then I scan because I have a scanner. It's not mine. I didn't buy it, so I'm not boasting here. And the lab sends me something like this, which is an overlay. And now in your head, you're like thinking, how the hell does that thing stick? Well, believe me, it does. It does. And if you do it correctly, you minimize the trimming. Let's say in worst case scenario, you leave decay, the patient needs a root canal treatment, right? You remove the overlay, you do the root canal treatment. Have you ever tried doing root canal treatment after removal of a crown? Trust me, 1, isolation, 2, everything else. Like I wouldn't even know. Well, I did it, but it's hard. So you give options. You say, I'm trying to help your tooth, basically. These are some of the case number 2. We see 2 teeth, cusp thickness less than 3 millimeter, peripheral rim fracture, meaning the sides of the tooth, I would say, they have cracks. The isthmus is more than 2 millimeters, meaning weakened tooth. Proximal box deeper than 4 millimeters, again, is all indications for I need to change this filling. And also they had sensitivity on their bite, because basically it's a cracked tooth syndrome. How do you diagnose a cracked tooth syndrome? Not many people know. It's very hard to diagnose cracked teeth. So I removed the amalgam. So I want you to look at it. You see 2 amalgams there. 2 amalgams, boom, huge, right? If you see an amalgam and missing cusps, like no 100% that there's pins in there. I removed the amalgam. You see those pins, boom, again, put bonding agent, put resin coating, and that's the result, right? Pretty good, yeah? I mean, the patient was really happy. So case number 3, this was one of my favorite cases until now. So I had this new patient examination, right? Okay, fair enough. I know that I have to talk. And again, I'm pretty good at talking, apparently. So before this patient comes in, the receptionist says, I have to give you something. And she gives me this thing. So extremely anxious patient, phobia of metal and spiky things in mouth, no metal to put in mouth, all remaining teeth to be removed via general anesthetic if possible. Upper and lower plates to be made. Plates are dentures in an English world. Sincerest apologies in advance, many thanks, blah, 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 right? So what do you do with this patient? How do you handle a case like that? Yeah, but I don't do sedation. So you're losing the patient, right? Hypnosis. So think about it also in a business way. As I said, dentistry competitive. Yes, in some instances when you're not confident, send patients away, refer them, whatever. But this is all about communication and obtaining the patient's trust, you know? So he sat down. I didn't even sit next to him. I sat opposite. I said, Mr. B, my name is Andreas. Nice to meet you. I see you had some kind of trauma in the past as a kid. I don't know. Everyone in England does, apparently. I'm in dental. No. So I say, look, tell me, I'm here to help you. I provide you with treatment options, care. I don't want you to be worried. You know how I did the checkup? I said, look, no instruments, gloves on, open your mouth, lips, hear that. I said, look, you have 14 roots to take out and 2 teeth or something. Yeah. I said, look, if you want, we can try it. He's like, you know what? It was like 25 minutes of talking. He's like, you know what? I trust you. Let's do this. Oh, also, he's like, I need these dentures for my wedding that will be in 4 weeks. Oh, thank you for the pressure, bro. You know, like, thank you. And especially full denture is hard to do anyway. So he comes the next week. I said to him, come on Saturday. Saturday is relaxed. I'm the only one in the clinic because I'm a maniac working on Saturdays, you know. So I said, come, sit. There's no one in the clinic. It's just me, my nurse, receptionist. Come with your wife, sit, you know, we can do this. If not, I can refer you. Always give options. Don't say, I can do this. Say, maybe we can do this, or if you want, we can refer you. Okay, don't say I can do this because you can get in a lot of trouble. Just especially those who's going to England, yeah. So we took out all the teeth. Okay, we took out all the teeth. In one day, impressions. Actually, we did like immediate dentures. Boom. We took impressions. When the dentures were ready, I took 2 hours to comfort him. Put some music on, whatever you want. I don't know, YMCA, whatever English people listen to these days. We took it out, and this was the result. Like, it's pretty good. I'm just gonna pat myself on the back there because I believe that was pretty good. And then he leaves, and he leaves this review. So had a great service experience with treatment. I was recommended and addressed the dentist by a friend. I'm a person who has a real fear of dentists, but this man made me feel comfortable, at ease, and calm my nerves, making me feel relaxed, blah, blah, blah. I'm happy. I'm getting married. I'm going to get wedding pictures. That's all. That's all. You know, what happens then? You gave them 20 minutes of your time because you said sedation, and don't ever push it. You said sedation, right? You gave them 20 minutes of understanding, of talking to them, to say, you know what, I'm not here to take out all your teeth and for you to leave. I'm here to understand you. I'm here to speak to you and provide you with the best I can do. The best I can do, not the best. Don't ever say the best because you can get in trouble for that. And yeah, so that was a very nice case, and I was very happy. And the patient, you know, and the other thing is you keep business because you keep the money in your clinic, in your business, in your practice, in your pocket. So think like that. All right. That's where a lot of dentists in England get confused. You don't have to sell, but don't lose confidence in providing comfort and understanding. And yeah, that's all. So any questions? Wait. Thank you.
Thank you, Dr. Cortezes. It was a pleasure for all of us.
Thank you for having me.
Actually, it's very strange to tell you, Dr. Cortezes.
It's strange for me too.
And I always tell my students that I keep on calling them with their names because I'm used to their names, and sometimes greetings from Dr. Who? I don't know this guy. So I prefer to call you Andreas. Okay, I am very proud with my student Andreas, because once a student of mine always. And I would like to tell you that the very first moment he contacted me and he asked me for this meeting, I said yes. Was that right?
Yeah, of course.
And I'm very happy for doing so. And after you were speaking, I understood that that's your way. You ask people, and that's the right way, the correct way of doing things.
I gave away my secret, didn't I?
Yes, you told us lots of secrets, but as you mentioned, you don't keep any secrets in dentistry. And why secrets? No need of secrets. Okay. Okay. So it's a pleasure to have you all here, and it was really nice to hear all that, because I share all the speaking Dr. Cortezes did. I'm sure they don't understand Dr. Cortezes.
No, you can comment.
Okay, I would like to share that they don't believe you, they don't believe me sharing such things. But they will remember this meeting. And in 1 or 2 years, they will say, oh, I remember that meeting. He was right. He is right. He is terribly right. And I would like to say I'm also right during my lectures and exercises, but you don't believe me. I know. I've spoken about biomimetics. Is that right? To your lectures, 30-year lectures, right? Okay, thank you. Yes. But who remembers?
No one.
Who remembers? No one remembers. That's why I'm very happy to have you here, Andreas, to talk to our students and to hear so many nice words for our university. And it is a real pleasure. A real pleasure to hear that, to share that. And I'm sure that all that you've said is so useful. They will remember, and then they will use it in their future life. There are different kinds of people. That is your way. I hope that in several years we'll have other nowadays students that will come back to our university and speak about their way, their professional way. But actually, you've got lots of knowledge in these 3 years after graduating the university, and I would like to congratulate you for all that, because it's a very nice analysis, which is commonly done in a longer period of time. You've analyzed the system, the insurance system. You've analyzed the professional connections. You've analyzed the patients, dentist connections, things like that. So you've shared a lot. I really don't know if you understand how much you did today. I understand.
Well, that was my reason. Look, I didn't come here to become famous or show you that I'm successful. I don't know if you guys heard it. I'm here to share, because nobody did this with me and said, you know, you will do mistakes. You will do a lot of mistakes, but you can move forward and to understand how to integrate in the postgraduate life. That's all I'm here to do.
And you've said so many things, but I hope there will be questions. So feel free to ask questions.
Hi, so my question is, you mentioned earlier that patient expectation is a big thing in dentistry. So how would you make sure that the patient expectations are controlled? Because, you know, sometimes the patients say, oh, I expect amazing treatment. So how would you make sure they understand the level that you're at?
Look, you have to analyze, you have to think of what pictures. That another thing I didn't mention that much is photography. Photography, why, you know, I spend like nearly £3,000 on my camera, is because I want to show patients why do they have a wrong bite? Why do they have this? Why do they have that? That's, you know, photos. Another thing, you can see sometimes the patients. For example, there's a category of people in England that I would not treat because they waste my time. I'm not going to say what category it is, but you can understand. But also say, look, we can do this, this, this. Always give consent forms. I'm talking about England, guys. So maybe Gleb next year can talk about Germany when it comes to uni.
Okay, so we'll wait for him.
Yeah. So consent forms, explain to them, we can do this, but a denture doesn't mean that you can buy apples on day one. Doesn't mean that you can go to Hollywood and become a superstar with your dentures right now. You know, you see, you give them what you believe can, but don't overdo it. I overdid it once, and trust me, there are consequences to that. And I paid for it with time, money, stress. So don't be over giving and don't be overconfident in something. But again, don't lose confidence. So that's, you have to analyze. I know what you mean. It's a very hard question, but you see the patient, you talk with them, and whatever, if you feel dodgy about something, consent form. That's all.
Always. Always. Yes, please.
Being basically from outside the UK, so you're from Cyprus and graduating from obviously abroad, when applying for jobs and like, you know, the British dentist, obviously recruiting new dentists, did you ever feel like you were either overlooked or, you know, when they found out that, oh, you're not graduate from the UK, did they ever feel or portray anything different or anything like that in opinions?
No. Well, look, I didn't have much time, but UK students, don't fall for corporate tricks. So signing bonus £10,000, forget about it. They want a slave. I promise you that. There's loads of jobs. Trust me, you will all find a job. 100%. Those of you who want to go into private, just learn first, whether NHS or a bit of nursing in the beginning, which I also did in Cyprus, but learn first, because private world is expectations a bit higher. Okay, so you will definitely find a job. Nobody will, they'll all look into your experience. For example, now I applied for a job in London, central London. I applied just randomly because I already have 3 clinics that I'm looking into moving, which are all private, really nice clinics. But I love, his name's George the dentist, one of the best dentists in England. And I applied for it. First thing he asked me is, do you have a portfolio? If you don't have a camera, you don't have x-rays, you just say, I'm good. What does that do?
They can have this photography in their 6th year as an additional education. So you know that, I'm sure, or you don't? Did you? Yes. Okay. So other questions from this part of the room? Because the time is running. It's a nice conversation, of course.
Okay. I was just wondering, because how would you kind of learn how to use certain new materials and technologies, for example, like amalgam fillings, because here we do a lot of composite. So like in the UK, they use amalgam fillings a lot. So
I don't. I minimally. I don't like them. They're mostly NHS. Yeah. Sometimes not bad, but look, you try to practice. So your question is how to basically be better in what you do, right? In certain treatments.
Yeah, because like certain treatments we won't do hair, but then maybe in another country if we go, they might prefer a certain treatment.
By the way, amalgam fillings, I think they're getting banned in UK in 2 years.
Oh, because I was told they use them a lot.
Yeah, they use them a lot now, but I think in 2 years they're going to ban them for good. So look, go on small courses, or what year are you in? Sorry.
5th year.
5th year. Why don't you ask one of your assistants? Tell them, look, I need some help. Go get some models. Mm-hmm. Tell them, look, or have extra private lessons. There's no shame in that. Yeah. I never did that. Because, as I said, my head was 60% partying, organizing parties, whatever, and 40% of trying to pass dentistry. You know what I mean?
Yeah.
So ask, and you shall receive.
Yeah.
That's all.
That's the way. That's your
maybe
way.
Even if we go to a dentist in the UK who uses amalgam fillings a lot, we can ask, like you were saying, we can ask if they can show us.
Just pack it in, bro. Just pack it in. That's literally, just put the amalgam and it stays there.
Yes, please. 6 years.
Yeah. Hi. I had 2 questions. So one was, how was your GDC application process like? And the other one is, like you mentioned earlier, obviously as a new dentist, private clinics aren't just willing to, just hire you because you don't have a lot of experience? So how did you get into private immediately, considering your lack of experience?
I had quite a bit of, well, I had okay-ish experience from Cyprus. But look, there's certain ways. There's another student from this university. He's with me in the same city. You guys probably know him. For example, he went through nursing a bit. He was looking, understanding. And another thing, a lot of clinics now, because they're moving from NHS to private, they're looking for, but don't jump straight away into big private clinics. Find a private clinic that has a mentor. Tell them, look, I'll just 2 minutes. I'm just going to do this. Okay. So I had about 6 interviews last month. What I said was, I am this. These are my cases I have. I am not the best dentist, but I'm learning and I'm trying to be better every time. Out of the 6, the 5 said, when are you coming to work? Because I came there and I said, look, I'm so good and blah, blah, blah. And I want to learn, but I will provide you with better treatments. Better treatment means more money. More money means happier bosses, whatever. And you're happier as well. So don't be humble in the beginning. Be humble, but not like, don't lose confidence. So don't say like, oh, I don't know nothing, blah, blah. I know this, but I'm trying to get better.
Happy to hear that, because I often say to my students that you can make the perfect restorations, but you just stay a poor dentist. So it's all about learning the rules, the management system, the insurance systems, and things like that. I think that Andreas is telling you so all of the time. And of course, self-education and self-esteem. More questions? Yes, please.
So just when we're looking at courses, like extra courses to do, because obviously there'll be a lot of options, what should we look out for when choosing them?
Well, in England, one is don't look for followers. Like followers don't mean nothing, in England at least. Look for reviews. Well, you're talking purely England, right? Purely England. Well, look, there's this guy, right? For not porcelain, for composite veneers, bonding, right? His name is Rodri Thomas, Dr. Rodri Thomas. I think he's 34. This guy's amazing. He's the best I've seen, like honestly, he's the best I've seen. So for that, in England, I can tell you that. Well, it depends what you want, There are some, if you just want to learn the odd filling here and there, to go on any course is okay. But if you want something more progressed.
I'll interrupt you because I have very good friends in UK from King's College also. And believe me, most of the courses will turn you back to your third year studentship, because they are on extracted teeth, no touch with patients at all. And that's a normal practice, that's right? Do you agree? Yeah, normal practice. They don't practice with patients at all if they are not postgraduate students. So you will not learn anything new. If you open your lectures, you have all this knowledge. I know that for sure. So excuse me for interrupting, but I think it should be clear to all. And you'll spend lots of money.
Yeah.
I like my friends from UK. Once again, they are very nice specialists. Thank you.
But yeah, a lot of courses are a waste of money. Like, don't get me wrong. Now, to build up some confidence, I don't know. As I said, these 1-2 courses that will teach you the main things. Yeah. Now I heard about courses about extractions on models. Like, come on, open YouTube. Like you're gonna do an extraction on a model that doesn't even breathe. Try to control a patient with an extraction that hurts him. Trust me, you will stress and sweat and everything. So open YouTube with simple things, lectures, material online. A lot of it I saw was from Instagram. My biomimetics, like 40% was from Instagram. You just look, you know, if anyone wants to ask me who to follow, as you can always message me, no problem.
Follow your lectures. Okay, thank you, Andres. More questions? Oh, enough for today. Of course, once again, it was a pleasure.
Thank you for having me.
It was a pleasure to see you again, to share your experience after graduating to the Faculty of Dental Medicine and the Medical University of Plovdiv, and also hearing these nice words about your teachers, about your studentship.
I think what Professor Machova did to me in third year was the best thing that happened to me.
Nice.
Then, okay, then it was Professor Firkova also on my birthday. That was the second best thing that happened to me. But yeah,
I have good friends, you know. I have very good friends, all mentioned here. So thank you once again, and thank you for all of you for your interest. I'm sure you can find Andres and contact him. And we are here with Dr. Daskalova, the president of the Alumni Club, and we are giving that certificate. Yes, you can become members of the Alumni Club. It's a very nice practice for every good university. So thank you once again, and that is for you.
Thank you. Thank you very much.
You are always welcome to us.
Hopefully there's going to be more students coming, sharing their experience. You know, it's nothing bad. I wish someone came and told me this stuff when I was 5th, 6th year, you know. It's not easy, but don't lose faith. Don't be cocky, you know. So, yeah.
Thank you very much. Have a nice evening to all of you.
Thank you.